This is a 30 years old lady. She is suffering from low back pain for the last 1.5 months. MRI is showing that there is a huge extruded fragment in L5S1 level, which is actually causing her pain. Actually, pain was very severe for initial few days. Nowadays, her pain has subsided, but there is severe numbness in her left lateral three toe, and her day-to-day activities has been hampering. She was totally bedridden for the last 15 days. That's why we have decided to remove her extruded fragment from the L5S1 level. There is also generated disc in L4, L5 level, but there was no that much symptoms from L5S1 level. That's why we have decided not to disturb the disc, which is not actually doing any symptoms right now. Our target is L5S1 level, and we will remove the fragment from L5S1 level. The fragment, there is a huge fragment. MRI showing there is a huge fragment just lateral the S1 nerve root, and our target will be remove the S1 fragment from S1. Now, after removing the ligamentum flavum, we have splitted the ligamentum flavum a bit, and from midline we come to the lateral margin of the nerve root. Just we remove the ligamentum flavum from medial up from medial margin of the supraarticular process. Now you are seeing that there is huge extruded fragment, whitish extruded fragment. We are trying to remove it by grasping it, and our target is to hold the whole fragment and make it sure that the fragment is coming in a single piece, but initially it failed. You have to remove your forceps just like crocodile motion, as crocodile moves. Just ensure that you have grabbed only the disc, not the thecal sac or nerve root. Just gently grab the disc and firmly keep traction, so that you can understand that you are actually removing the disc only and not injuring the nerve or dural sac. And another thing is, you have to initially cauterize the disc material, around the disc material, because in newer cases there will be inflammation, and around the disc material there will be neovascularization. See, we have removed a big fragments from the side, and now we are holding another fragment, another quite big fragment, but it is not coming easily. We are trying to hold it firmly so that we can remove the fragment, and we have hold it with gentle traction, but it is very difficult to remove it safely. Sometimes we are trying to hold it, not holding thecal sac or nerve root. We have to keep in mind that we are not holding the thecal sac or nerve root, and we have grabbing the fragment. The fragment is so big that it is not coming through the scope. As the ladies doctor, our motto was to reduce tissue trauma, and with total scope, it comes with total scope. See the fragment, it is very big fragment, and the fragment is inflamed, reddish in color. Actually The extruded fragment, usually extruded fragment, there is no normal blood supply. That's why it's become degenerated in times. After the big fragment, again we put our scope inside the sheath. See, another fragment, another small fragment has come out. It is also reddish in color, blackish, actually blackish in color, because it becomes degenerated with times. Body try to heal it, body tries to phagocyte it and reduce its size, try to reduce its size. After removing the fragments, now see the nerve root is quite pulsatile. Now it is seems that nerve root is quite free. Some oozing is coming out, and see the S1 nerve root. That's because there was almost 2 months, compression of almost 2 months. See the margin of the nerve root is quite reddish. That is unusual. And probably this is the cause. This hyperemia is the cause. Hyperemia is actually because the nerve was severely compressed its shoulder by the fragment. That's why there is hyperemic. The nerve root is hyperemic, and now I am cauterizing lateral side of the lateral aspect of the nerve. Lateral aspect of the nerve in disc area. We will have to remove those excess fragment, and we will have to do angioplasty, so the size of the annular defect become reduced. It will help her reducing the chance of her recurrence, dural recurrence. Grasping to remove all the free fragments from here. See, the nerve root is not healthy. The S1 nerve root of her left side is not healthy. We are removing free fragment from inside the disc. Removing the free fragment, removing free fragments. Which came out minor pressure, just like sneezing, or sometimes forward bending, even can reherniate from this small tiny hole of the annulus. So we are trying to remove all the free fragments from this area, so recurrence rate could be less. See, now the nerve root, it is getting its blood supply. Again, some oozing is there from the nerve root. See, the lateral margin of the nerve root become completely free now.
নিউরোপ্রাক্সিয়া কিন্তু সময়ের সাথে সাথে করে ইমপ্রুভ করে।
Our target is to make the nerve root totally free. Lateral wall should be free. Now we will search if there is anything in the axillary area, because there was huge fragment. With tang of the sheath, now I am retracting the nerve root towards opposite side, little bit retracting, because if we retract, then there is possibility of neural injury, and you have to release the pressure within 10 seconds, not more than 10 seconds. Don't try to retract the nerve long time. It is very dangerous. If you retract now long time, that may cause neuropraxia, even foot drop, anything can happen. This is the axillary area where searching is there any free fragments in axillary area. with nerve hook. We are seeing whether there is any free fragments under the nerve hook or just
ওরা তো
immediate
বুধবারে
below the
এটা
annular tear.
একা গেছি আবার
There is no free fragments under the
তাও দিছে আব্দুল
tear.
সালাম
Hemostasis is ensured. Now it is the time to come out of
আমি
the
ইয়ে দিতে বলি তো এটা
canal.
EMI একদম অনগোয়িং
20
তারপর বলে স্যার এটা
it is
এক
done.
বছর আগে
It is very
তখন দেখলাম স্টেবিলেশন
clean-cut,
নাই
very,
প্যাথোলজি বাকি সব ঠিক আছে
specific
camera off.
procedure. No such muscle tear, no muscle injury, and it is done.